Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum, dean of Sama Institute of Health. In this series, we are going to discuss basic emergency care. We'll start with ABCDE approach and sample history. The objective of this session is to explain why to use ABCD approach, discuss safety issue when approaching a critically or acutely ill patient, and then we're going to discuss how to assess and manage element of ABCDE, A airway, B breathing, C circulation, D disability, and E exposure. The first question, why do we need an ABCDE approach? This approach, we use it to approach every patient in a systematic way. Acutely ill patient could be undifferentiated, and sometimes you might not know or you cannot immediately know the diagnosis. A systemic approach helps us to identify priorities, and it helps us to recognize life-threatening condition as early as possible, and we can do most critical intervention first and fix them before we move on. So ABCD approach is a very quick method in stable patient. You can do it in a very few, even in 1 or 2 minutes or less. So the goal to identify life-threatening condition rapidly, ensure that the airway is patent and that this airway is able to move oxygen in, and you make sure breathing and circulation are adequate. So all this to sustain and maintain life. And in sample history, this is a very simple way of gathering information. After you do your initial assessment, then you need to go in little bit depth to see from the sign and symptom uh, what can help you to figure out the cause or establish a diagnosis. So first look at the sign and symptom in more detail, and if there is any allergy, this could be a precipitating cause, and it helps you to avoid any dangerous medication. And look at the patient medication, what is he taking, and also you want to elicit past medical history, if the current problem is related to his past history or not, and you need to see if when was the last time did he eat or drink. So if you want to do some interventions that require fasting, and the event surrounding the current illness. So immediately follow the ABCD approach. Uh, Allow provider to easily communicate, rapidly gather history criteria. This can enable you manage an acutely ill patient. One of the most important things is that you need to look at the scene. You want to make sure the situation, it will not endanger you and your team if there is a team with you. So if there is a collapsing building or there is an explosion, you want to maintain your safety and the safety of the others. When there is fire, also you need to make sure the scene is safe to approach. We don't have to have another patient, and we don't want to make you a burden on the staff managing the situation. When there is a collision and motor vehicle accident, also observe the safety. And when there is violence, especially when there is gun shooting or someone endangering others, you have to observe the safety. When there is gas spill or chemical spill, you have to maintain the safety for all of the people there. And in hospital, in healthcare system, it's about the standard precaution, especially during outbreak. So you need to maintain the appropriate standard precaution and personal protective equipment whenever needed. Some understanding of basic infection prevention and control. Hand hygiene is must all the time. When to use glove and when to use sterile or clean gloves. uh, when to use gowns, masks, goggles, hand washing, and hand hygiene is standard all the time. So for safety precaution, make that there is no any hazard in the scene, no violence, and no infectious disease that risk you and risks others. And use personal protective equipment appropriately. Always try, if there is contamination, try to clean and decontaminate and use the appropriate PPE, personal protective equipment. And ask for help whenever you need that. And especially when there are multiple patients, and make arrangement for transfer if you need a high level of care. And whenever you have an outbreak, you should know the chain of communication, to whom you should communicate, and when there is chemical exposure, to whom you should transfer this information. uh, Imagine a person coming to your office or to the emergency room vomiting blood and complaining of abdominal pain. Though you want to help him and save him, but putting personal protective equipment is important in such situation. You need to do the hand hygiene, you need to put a glove, you need a gown, and because there might be spill, you need goggles for the eye protection and a mask to protect your mouth and nose. Always think forward, ask for help whenever you need it. If there are multiple injured patients, ask for help also. And think about where you want to transfer this patient and how you're going to do that, and what communication you need to do. And when there is environmental hazard or outbreak, think about chain, chain of communication. Thank you. We're going to continue on the next sessions.